Hello, my name is Dr. Robert Hedaya. I'm a clinical professor at Georgetown University School of Medicine. I'm on the faculty at the Institute for Functional Medicine, and I am the founder of the Whole Psychiatry and Brain Recovery Center in Maryland. I'd like to talk to you about a plan that will save lives and help America open up quite rapidly, and it's called the COVID Kit Plan. And the idea is simple. The idea would be that we have three goals. The first goal is that we want to identify the symptoms of COVID-19 within the first 5 days of symptom onset. Why? Because this is a critical time period during which the virus itself is quite easy to treat with appropriate measures. I've read the literature thoroughly. I continue to read the literature thoroughly, and I have treated a number of patients with COVID-19, some who've actually been in high-risk categories. And with rapid intervention within the first 5 days, you've got 5 days to treat this disorder easily. With rapid treatment, you get excellent response and very, very low long-term morbidity and mortality. The second goal is to make sure that every adult in the United States has a COVID kit in their home for themselves. The third goal is to save lives and eliminate closures within the United States. We should be able to treat this very effectively if we treat it very quickly and with appropriate measures. So the plan is treatment and identification and treatment within the first 5 days. Everyone's got a COVID kit in their home and 0 closures. How does this work? The kit will have medications, 2 options for medications, which used in the first 5 days are quite effective, supplements which work to support the immune system, and an instruction card which will help guide the patient through the process. The instruction card will identify the 4 classes of symptoms of early COVID. These symptoms fall into the standard, what you might think of flu-like symptoms, which could be a scratchy, sore throat, dry cough, shortness of breath, chest pain, muscle achiness or fatigue and headache, sometimes fever. That would be a flu-like category. The next would be neurological, which could be loss of sense of smell or taste, as well as numbness or tingling. The third would be gastrointestinal, which is often just nausea and sometimes diarrhea. And the fourth is what I call TOVID, which is a discoloration due to lack of blood flow in the toes or in the hands. The card will have instructions on immediate ways of contacting the primary care physician. As soon as you have an onset of symptoms, the physician can then monitor you over the next day or 2 to see if the symptoms progress, as well as instructions for the remainder of the family regarding quarantine and prevention measures should someone in the family actually be ill. Finally, there will be a pulse oximeter to measure oxygen and heart rate. The kit itself will contain 2 patients for people without any history of or risk of heart disease. That will include hydroxychloroquine and azithromycin. And the second medication category will be for those with a history or risk of heart disease, which will include ivermectin, a long-standing and old antiparasitic medication, as well as famotidine, commonly available over the counter. In addition, there will be supplements, very inexpensive supplements that will help support the immune system. This is the plan. It's a very simple plan. It's a common sense plan to help people identify and treat COVID-19 quickly and reduce morbidity and mortality and help open our country. If you agree with this, please share this video so that we can change the narrative and get America moving and, most importantly, save lives. Thank you very much. Have a good day.